We've now left the gram-positive cocci and we're moving on to the aerobic gram-positive bacilli, or the gram-positive rods. This lecture has been broken down into 5 different parts, and this lecture is the first of the 5 parts. Our gram-positive bacilli have been broken down into the organisms that are non-sporogenous or non-spore formers, those that do produce spores or the sporogenous organisms, and those that are called branching or filamentous. For the non-spore forming gram-positive rods, we have the genera Corynebacterium, Archanobacterium, Rhodococcus, Lactobacillus, Listeria, Erysipelathrix, and Gardnerella. For the spore-forming gram-positive bacilli, we have the genus Bacillus. We also have the branching or filamentous gram-positive rods. Some of these organisms are partially acid-fast, and acid-fast is another type of stain that can be done in addition to gram staining, and we'll talk about that in this lecture. But the organisms that are considered partially acid-fast are the genera Nocardia, Rhodococcus, Gordona, and Sucamarella. And we also have those that are non-acid fast, such as the Streptomyces genus. We're going to start off the gram-positive bacilli lecture with the genera Corynebacterium. There's many different species within this genus, and the Corynebacteria in the clinical laboratory are collectively known as the diphtheroids. In general, there are 66 species in the Corynebacterium genus. 38 of these species are considered to be clinically significant. Most of these organisms are normal flora of the skin and the mucous membranes of both humans and animals. They're found throughout the world, and they're very closely related genetically to the Mycobacteria and Nocardia genera. The species of Corynebacterium that we are going to mention in this lecture are Corynebacterium diphtheriae, ulcerans, pseudotuberculosis, gychium, ureolyticum, striatum, xerosis, and pseudodiphtheriticum. We're going to start out with our big boy organism. Remember those organisms, there's usually one species in each genus that is associated with causing very severe disease. Well, Corynebacterium diphtheriae is the organism of the Corynebacteria that cause significant disease. The general characteristics of Corynebacterium diphtheriae are the incubation period is between 2 and 5 days, and the incubation period is the period from the time that the organism gets into the body to the time that symptoms develop. The symptoms include pharyngitis or tonsillitis, and the key characteristic about the organism Corynebacterium diphtheriae and the disease that it causes, which is diphtheria, is it forms what's called a pseudomembrane at the back of the throat in the tonsil area. Corynebacterium diphtheriae can also cause a cutaneous or skin infection, such as pustules and a chronic non-healing ulcer. There are again 2 different forms of the disease diphtheria. There's a respiratory form and a skin or a cutaneous form. Diphtheria has become a very uncommon disease in the United States due to the diphtheria vaccine. So in the US we have the DPT vaccine that everyone gets as children. It's diphtheria, pertussis, and tetanus. However, there has become a movement in some individuals where they're against vaccination. So over the past 10 years or so, in the U.S., there has been an increase of diphtheria cases, and it's all due to not people not vaccinating their children as regularly. The respiratory form of diphtheria causes pharyngitis or tonsillitis and that pseudomembrane exudate in the back of the throat. So what this pseudomembrane is it's a membrane-like structure that contains fibrin, white blood cells, bacteria, cellular debris. It can involve the larynx and the trachea. And what happens in individuals with diphtheria is they get this large bulging neck called the bull neck, and it's cervical adenitis or swelling of that region. The problem with diphtheria and what can make it turn it into a life-threatening disease is that pseudomembrane can actually grow across the back of the throat and cause respiratory obstruction. So the individual has severe difficulty breathing. Diphtheria can resolve itself within 5 to 10 days. The cutaneous infection is much more common in the tropical regions, and it usually is typical skin infections, pustules, and this chronic ulcer that never quite goes away. Here's a picture of that pseudomembrane that develops in the back of the throat of a diphtheria patient. This is a 10-year-old boy that had severe diphtheria. He had conjunctivitis or an eye infection. He had the pseudomembrane in the back of his throat in the pharynx region. You could see the picture. He has an enlarged neck, or what's called the bull neck. In this case, he had inflammation of the myocardium, the lining around the heart. So it is diphtheria, like I said, is seen in the United States, although it is a more rare disease. Again, another picture showing that bull neck appearance that is commonly seen in diphtheria patients. So the complications of diphtheria, we already said that respiratory obstruction of the pseudomembrane that can lead to suffocation. And diphtheria can produce a toxin which can lead to systemic effects in the body if the toxin is absorbed into other areas of the body. So that toxin can get into organs such as the kidney, the heart. There could be nervous system involvement, and it actually can lead to cardiac failure and death. Humans are the only natural host for Corynebacterium diphtheriae. It is considered normal flora of the skin, oral cavity. It's found all over the world. There are asymptomatic carriers of Corynebacterium diphtheriae. That's why the vaccine is so important for this organism, because people do carry it as normal flora, and if someone isn't vaccinated and gets infected with it, it can turn into a life-threatening disease. Typically, there are 0 to 5 cases per year in the United States. However, like I said, over the past 10 years or so, there has been an increase in cases. Transmission is commonly through droplet aerosols, so breathing in infectious particles from another person, and also hand-to-mouth contact. Prevention, the best way to prevent diphtheria is through the vaccine. You get a diphtheria toxoid at 1 year of age, and boosters are given every 10 years. There is something that can be done called the Schick test, which determines an individual's immunity against Corynebacterium diphtheriae. So what you do is you inject a small concentration of toxin under the skin, and if you get a little local swelling in that area, the individual is considered to be positive or susceptible. If there is no swelling, so that toxin is neutralized by the antibodies in the person's body, then that person is immune. So that's a very quick test that is not commonly done in the United States, since in the U.S. Usually you can't go to most schools without showing proof of having the diphtheria vaccine. Diagnosis is through nasopharyngeal and throat specimens for the respiratory form of the disease, or exudate from skin lesions in the cutaneous form of the disease. Microscopically, Corynebacterium diphtheriae organisms are, of course, gram-positive. They are somewhat pleomorphic, so they're not very uniform in their shape. They can form palisades, in other words, they pile on top of one another. There can be V formations, L formations, and depending on what textbook you read, the diphtheroids are commonly referred to as having a Chinese letter formation because they kind of form these right angles and group together and kind of look almost like you're reading Chinese letters. They can be club-shaped in their rod morphology. They tend to stain very unevenly, so they have what's called a beaded appearance, where along the rod there'll be some sections that are much darker than other sections. And this is due to the fact that they have metachromatic granules that don't take up the crystal violet stain as readily. Corynebacterium diphtheriae is a non-spore forming organism, and it is not motile. There are special media that are needed to grow Corynebacterium diphtheriae. So these media include cysteine tellurite, Loeffler's, Tinsdale. It will grow on blood agar, and on 5% sheep blood agar it tends to look like a staphylococcus, but it has a kind of a more grayish color to it, so it's referred to as looking like a dirty staph. Many Corynebacterium diphtheriae species have a very tiny zone of beta hemolysis around them when grown on 5% sheep blood agar. To identify Corynebacterium diphtheriae, you can do biochemical tests on it. You also, of course, want to look at its antibiotic susceptibility profile, and you can do toxin testing to see if the organism is a toxin producer. The diphtheria toxin is the major virulence factor produced by the Corynebacterium diphtheriae organism. So this toxin is of course produced by Corynebacterium diphtheriae, but it is also produced by a couple of other species of the Corynebacterium, such as Corynebacterium ulcerans and Corynebacterium pseudotuberculosis. What happens is some of these strains, if they have a virus, one of those bacteriophages, a virus that infects bacteria, that has the tox gene, then those organisms are able to produce the diphtheria toxin. Only Corynebacterium diphtheriae strains that can produce this diphtheria toxin are able to cause the disease diphtheria. So you can have or carry a Corynebacterium diphtheria organism that is not a toxin producer. So that organism would never be able to cause the disease diphtheria. So that toxin is critical and essential for the disease diphtheria. That toxin is a 62,000 Dalton protein that's lethal for humans in a very small amount. So 130 nanograms per kilogram of body weight can be lethal. The diphtheria toxin blocks protein synthesis. So what happens is the toxin is there, it's not doing anything bad until it's exposed to trypsin. What happens is trypsin will cleave it into two fragments, fragment A and fragment B. And once it's cleaved into these two fragments, it then goes and starts killing the cells in the body. Treatment for individuals that have diphtheria is antitoxin. So you have to try to get rid of as much of that toxin as early as possible. The problem with giving patients antitoxin is antitoxin can cause serum sickness. The antitoxin is produced in horses, and there are a lot of individuals that are allergic to horse serum. So sometimes the treatment of antitoxin causes people to be just as sick. There are antibiotics that can be used, so most Corynebacterium diphtheriae organisms are susceptible to penicillin. If it's a Gichium group of Corynebacterium, you need to treat with vancomycin. There's also supportive treatments. If an individual has a pseudomembrane growing in the back of the throat, that pseudomembrane sometimes has to be surgically removed, and also regulation of the respiratory, so making sure someone can freely breathe is very important in the disease diphtheria. This slide shows the incidence and immunization of diphtheria. And here's some posters that are very old that used to be put up around the United States to try to remind people to go get vaccinated for diphtheria. Another species of Corynebacterium that can produce the diphtheria toxin is Corynebacterium ulcerans. This is an animal pathogen, and humans are usually infected through animal contact. Corynebacterium ulcerans causes a very similar disease to Corynebacterium diphtheriae, however, it's a much more milder form. And that is because Corynebacterium ulcerans does not produce as much toxin as Corynebacterium diphtheriae produces. So Corynebacterium ulcerans causes a very mild pharyngitis. Corynebacterium gichium, this is normal skin flora. It can cause nosocomial infections or hospital-acquired infections in patients that are severely immunocompromised. It has been associated with blood infections with individuals using prosthetic devices. The Gichium Corynebacterium is a strict aerobe, which means that any type of low oxygen level can be toxic to this organism. This organism is very highly resistant to antibiotics, so it would be treated with vancomycin. The Corynebacterium ureolyticum organism is one of the more frequently isolated species of Corynebacterium. It's primarily a urine pathogen. It's more slower growing, so you have to incubate cultures for at least 48 hours before you'll see a colony on an agar media of Corynebacterium ureolyticum. This organism is also a strict aerobe. It's catalase positive. You remember our catalase test from our gram-positive cocci organisms. It does not ferment glucose. It rapidly becomes urease positive, so there is a urea media, and organisms that produce urease will cause the media to turn a bright pink color. And the Ureolyticum species does resist a number of antimicrobial agents. Corynebacterium xerosis is normal flora of the skin and mucous membranes. Again, it can opportunistically cause infections such as prosthetic valve endocarditis. So individuals that have heart valve replacements can sometimes get an endocarditis from this organism. Disease by the xerosis species is much more common in individuals who are immunocompromised, and this organism will grow on sheep blood agar as a very dry and colony that has a yellow to tan pigment. The striatum Corynebacterium species, again normal flora, nasopharynx and skin. Nosocomial or hospital infections have been reported, but this is a very rare cause of infection in humans. Now we're going to talk about the diagnosis of your Corynebacterium. On Tinsdale media, which is a special type of media that can be used specifically for Corynebacterium, the organism will be a brown to black in color and maybe tinge the media a brownish black, so it looks like it has a halo around the organism. On cysteine tellurite medium, the organism is a gray to blackish color. On blood agar, your diphtheroids are flat, dry, grayish white colonies, and your Corynebacterium diphtheriae on blood agar tends to look like a dirty staphylococcus. This is a picture of Corynebacterium xerosis on Tinsdale agar, and you could see the dark brown to black color of the colonies, and it tinges the media so that the media looks like there's a little halo around the organism. Microscopically, we already said the Corynebacterium are gram-positive. They tend to be in a club shape. They form random formations, so when you're looking at them under the microscope, they're not very uniform. They are non-spore forming, they are non-motile, which means they do not have flagella, and they tend to stain very unevenly due to the metachromatic granules. And here is your typical microscopic morphology, and you can see they tend to somewhat cluster together in these random forms. To identify the species of Corynebacterium, you can do biochemical tests and you can do toxin detection, especially for the organisms like Corynebacterium diphtheriae that can produce the Diphtheria toxin. One key thing is if an individual has diphtheria or is suspected of having diphtheria, just because you identify a Corynebacterium diphtheriae organism, it does not mean that that individual is diagnosed with diphtheria. In order to be diagnosed with diphtheria, you have to isolate the organism and show that that organism is producing the Diphtheria toxin. So toxin detection is critical for diagnosis of diphtheria. So the diagnosis depends on that toxin production, and you can look for the toxin using ELISA tests. You can do polymerase chain reaction to detect that tox gene, and there's something that can be done in the clinical lab. It's more commonly done in a reference laboratory, and that's called the ELEK test. So what the ELEK test is, you have an agar plate and you have lines of your suspected organism. So let's say you isolated some organisms that you think might be Corynebacterium diphtheriae. You would streak the organism along the center in lines of an agar plate. You would then take filter paper that's impregnated with anti-diphtheria toxin and place it right over those lines of organism that you streaked across. If any of those organisms that are streaked out in a line are producing the toxin, the diphtheria toxin, it will react with the antitoxin in that filter paper, and it will generate these precipitin lines that you could see coming out from the organism. So if you see those precipitin lines, that would be considered positive for being a toxin producer. And you have to show that the strain is producing diphtheria toxin in order to diagnose someone with diphtheria. So our next part of the gram-positive bacilli lecture is in the next group in part 2.